Hi, good morning, everybody. Aloha. Thanks for joining our webinar. Okay, good. Eugene, can you see in Facebook? Can you put me a like on Facebook? No Facebook yet? It should have Facebook now. Can you see whether Facebook is on? Eugene, see if you give me a 1, if you see it in Facebook. I know you can see me in Zoom now. Give me a 2 then. If you no Facebook yet? Okay, how's that now? It should be. Hold on, no Facebook yet. Okay, hold on. I'm good. You have to share the Facebook out to CTT. Okay, because they cannot see it right now. Okay. Oh, okay, good. So Eugene, can you see Facebook yet? Because they will show Facebook soon. So I just want to make sure you guys get Facebook. Give me a 2 if you see Facebook. Anyway, today is a very interesting, not yet. Okay, keep looking at it. If you can see it, it should be in ctt.com and also Lowsutea, in the Lowsutea Facebook. See whether, because I saw it live already, but I don't know if Facebook added out yet. Okay. So anyway, today, there's a reason why I did this webinar, because a lot of people are asking me, hey, is diabetic actually related to fatty liver? And actually it's severely a tremendous relationship. And we found that actually lots of people really got fatty liver because of diabetic, or because that diabetic is a sign and symptom and they convert themselves to fatty liver. So it is a very good subject to further learn more how you prevent yourself not to get serious problem on that. So that's why I think it's an extremely good webinar. A lot of people don't talk about liver somehow, but it's an important liver concept that you really have to get yourself, understand what the liver do, what affect to you, and how you prevent yourself to get fatty liver, because that is not a good thing to have a fatty liver disease. And I tell you some of my ICU experience and ER experience. Okay, as by the way, is Eugene, can you see us in Facebook already? Can you be 1 and 2? Okay, good. You saw it in Facebook. So you can be a 2 in Facebook, right? Excellent. Thank you. Thank you very much. All right. So I think we all have connected in Facebook. A lot of people actually see us in Facebook too. So we know that is good. And the reason why we actually do the webinar on this particular interesting topic, because a lot of people don't mention about fatty liver. And when I talked to the doctor, he said, hey, this is an important topic to talk about. And because there's a lot of diabetic actually really just ignore this part and don't talk about fatty liver. And even, let me share with you a couple of experiences really actually alert me. Remember, I'm an ICU nurse before, right? An ER nurse. And in ER, when I'm working in the emergency room, a lot of guy that comes in with very heavy weight with big tummy, this is really big tummy, and they're very sick. And a lot of people comes in, they actually, first of all, do not understand they have diabetes. Matter of fact, they shout in surprise, and you mean I have diabetes? Are you kidding? And they have the fake fat tummy. But you know what happens when you have fat tummy? That's a first sign already shown. There is a chance you're already in a possible stage of the diabetes, first of all. Second, is a sign most likely you have fatty liver because of your big tummy. And then when I went to ICU, made up this patient, I end up with have surgery. And I actually went in to take a look what they look like. And I was surprised when I look at that. Many of the people with fatty liver, the hearts, the aorta, the major vessels are full of fat, actually all cover that. And secondly, they also see the liver is full of fat, the pancreas full of fat, the gut, and also the peritoneum is also full of fat. So I said, wow, that is a real actual issue. They get stuck, all the fat stuck there. You know what I mean? So I now understand that is absolutely important to really get rid of your fat, because it's not say I will get rid of my fatty liver, other fat will not be there, because once you get rid of the fatty liver, you also help to get down your other fats. Okay, so this is why this is such an important webinar, to help you understand how you become your better health. You know, I think that's this lecture is all about. And I really thought that, wow, that is so important. Okay， 各位堂友，今日我有好多堂友不同地方啦，咁anyway 多謝阿 Pat 其他香港嘅堂友 join 我哋啦。咁點解我係要講呢個叫做肝臟係要肥肝臟咧，係有呢個問題咧？咁其實咧係因為好多堂友咧都唔知呢樣有嘢呢樣嘢嘅，因為好多時咧你係有呢個糖尿病咧，當你自己揾到自己糖尿病嘅時候，好多時咧有個問題咧就睇唔到個大肚墩，原來裏邊就好多肥嘅。咁我喺做 IC 同 ER 即係急症室護士嘅時候咧，睇好多呢啲病人入嚟嘅時候咧，話要咩我依家係糖尿病咩？因為見到佢嘅大肚墩 ，OK， 呢個大肚墩咧全部係肥嚟嘅。咁好多啲病人咧就去開刀嘅時候，我亦都會睇到佢哋咧，哇個肥啊好緊要，肝嘅肥啦、心臟肥啦，嗰啲肥谷揸住晒嗰個大動脈啦、大靜脈啊，跟住大動脈同靜脈兩都有啦。其他嘅 organ 咧，成個肚都係肥啦。咁呢啲肥咧，其實唔係話淨係減低個肝嘅肥咧，其他肥都會減低嘅，咁就幫助整體更加健康。So really at the end of the day, today's webinar is a really good enlightening to let you know what is really truly what they call a fatty liver, how you protect the liver, then you can help you to better understand how to maintain a better health. So I'm going to start sharing my screen, and so you can able to see my PowerPoint. Eugene, can you tell me you see my PowerPoint? Can you give me a 1 if you see the PowerPoint correctly? Okay, excellent. You can see my PowerPoint. Really good. Okay, very good. So we're going to talk about how do you protect liver. But it is really not only diabetic client, because you have to also think about the pre-diabetic client also have the same issue. It's not only diabetic, because really a lot of people actually come in pre-diabetic already have that symptom, because fatty liver is a really true symptom. If you don't take care of it, you know what to have. You're going to have liver damage, and it's going to get worse, and you got poor health. Okay, so let me get a couple of minutes just to review what we have previously. Remember, you might say, Andrew, you repeat so many times, but a lot of new people now. Today we have people from United States, we have Hawaii, we have LA, we have Vancouver, we have Hong Kong, we have Singapore, we have Australia, all the different places, and Philippines. But importantly, some of them are new guys coming. They have to know about diabetes cannot get well. You can only control. In order to control, you have to drive your A1C below 6.4%. Percent is not 6.4. It's not your average blood sugar. It's A1C. And the pre-diabetic is the same thing. You have to drive that also below 6.4. If you don't do that in 3 years, you will convert to be diabetes. So how do you do that? You have to do proper dieting, exercise, weight control. Your blood sugar has to monitor, and also your you have to listen to a webinar. You have to track your blood. Important tracking your blood, because only way to understand blood sugar record or understand are you doing good or bad is by your blood test. You cannot tell the others. So dieting is so important. You have to change your lifestyle. No more soda, no more juice. You gotta take no white bread, white powder that much, and drink Lowsutea. And that is truly, if you have this regimen, I can pretty much guarantee you can improve your blood sugar. I see it from my own eye that people actually drop the blood sugar from A1C 9, 10, all the way to 6, 5.7. Some went down all the way to 5.2. So it really works, okay? So do it. You are committed. 嗱，各位朋友，我知各位你話我都聽過啦，我知道糖尿病唔好嘅。其實我繼續係 repeat 咧個原因就希望你入到腦啊。第一，糖尿病只係控制啫，唔會好嘅。第二樣嘢，你一定要個 A1C 咧係跌到去6.4以下 percent 嚇。第三，糖尿病前期患者一樣要計到係降低個血糖。第三就要有呢個好嘅 diet 啦、exercise 啦，同埋 weight control management 啦，即係磅數啊、驗血啦，你用個篤手指好，或者用 Ability 好，同埋聽我哋依家講座啦，更加了解呢啲糖尿病嘅問題啦。咁你而家控制你整體嘅生活習慣啦，唔好食白粉嘅食物啦，好似飯啊嗰啲咁東西，或者食少啲啦，白嘅麵包啦，唔好飲 juice 啊、soda 啊嗰啲咁嘅嘢啦。可以去飲血糖茶就會幫助你真係降低血糖嘅，呢個一定會嘅。咁其實本身嚟講咧，最大問題咧就當你有呢個cholesterol 高嘅時候咧，就 damage 你嘅胰臟咧，就個 B cell 唔會話帶啲糖去嗰個cell 細胞裏邊。咁繼續做呢樣嘢嘅時候咧，你嘅血糖同埋你個呢個膽固醇咧增加嘅時候咧，咁你變咗咧就會 form 到好多呢個 plaque 咧，所以你血壓會高。咁血壓高嘅時候咧，就第二個 stage 咧就係嗰個血壓就上升。咁如果你啲咩都唔做，咁變咗咧就第三個 stage 就係你變咗前期患病啫，5.7至6.4。然後再後咧，如果再唔做嘢就變咗糖尿病者啦。So just to be reminded is 4 stages. The first stage is your cholesterol will go up, and then it damages your pancreas B cells, and that result your pancreas no longer work to provide a B cell, take the sugar into the vessels, to the cells rather, and then that result your blood will become thickened with the sugar, and that result form a lot of plaque, cover all these areas, the blood vessels become hardened. The second stage blood pressure goes up. The third stage, which you don't change your lifestyle because you have no sign and symptom, then you will become a pre-diabetic. Instead of 5.7, you go to 6.4. During this range or A1C. And then fourth stage, you never do anything 3 months. 3 years, you convert to diabetes. This is a typical transition. Now, important why we take Lowsutea because guava leaf actually blocks sugar into the cells. Bitter melon takes cells into brings sugar to the cells. Then you basically, one more very interesting thing is that bitter melon also help to take the sugar, cholesterol, and salt out from the urine out. And then that result, your blood pressure will improve and also detox. So this is a really wonderful thing to have. Now, you don't take care of yourself, you know what can happen? At the end of the day, you're going to have your blood, you're going to have a stroke, you're going to have, could be a cataract, pancreas malfunction, you have risk of heart attack, you have nerve damage, and you have high blood pressure, you might amputate your foot, and all the way up to the leg. Diabetic nephropathy, you have damaged kidney, you have to dialysis, and then you have complicated of your pregnancy, and then 30%, think about it, 30% diabetic patients have no sex function, it's dysfunction. That is really sad for a lot of people. So don't put yourself into that position, being a diabetic, seriously. Okay, so today we're going to talk about how this related to your liver, why this is so important. And after this, we'll talk about almond bread with tuna sandwich, which is so delicious. You will love it because it's a 2 gram with a tuna, depends on how much tuna put in there, is like 10 to 15 gram carb. It's a wonderful lunch or snack for you. Okay, now keep in mind, liver is a very important organ for you to help you to detoxify your body and metabolize your drug and also absorb all the nutrition and even give you sugar. If you don't have enough sugar, they will give you sugar to your body. 嗱，肝臟係好重要嘅，因為點解一個重要器官咧？因為第一佢同佢排毒身體嘅，仲有代謝所有嘅藥物啦，吸收營養啦，甚至咧係身體咧需要你嘅供糖嘅時候，佢俾糖俾你嘅。 So why diabetes need to protect the liver? One of the common conditions is diabetic has built a lot of excess liver fat. From there, it will end up result fatty liver. Okay, see, that is very interesting. So if you have fatty liver, your poor management with the fat and so forth, it worsen your fatty liver disease. And then if you have further diabetic complication, it get worse. Okay, so you gotta learn how to protect the liver in this webinar so you become better health. You don't want to get diabetes and get one more problem, your liver disease. Wow, that would be terrible. 嗱，點解每一個糖友咧要保護自己嘅肝臟咧？因為咧好多時咧，我係好常見嘅。其實咧，佢話有成8-9成嘅人咧，如果佢係糖尿病咧，都有呢個症狀嘅，係肝脂肪過多，數字咧就脂肪肝。呢個係好常見喎，原來。如果你個脂肪肝唔係管理得好嘅話咧，最弊咧佢就變咗你個肝係損壞啦，會繼續惡化啦，咁你糖尿病又繼續惡化啦。咁你如果係唔保護肝嘅時候，你就更加多一種嘅問題出現咧，令到身體更加差啦。所以其實呢個 webinar 咧就幫助你更加了解多一啲咩嘢叫做脂肪肝，點解糖尿病嘅脂肪肝？講講啦，如果你係睇 Facebook 嘅話，你可唔可以俾個 like 我啊？喺個 Facebook 嗰度俾個 like， 咁我知道你都係睇緊 Facebook。So people who are viewing the Facebook, also can you give us a like Eugene and whoever? Can you give us a like so we know who is watching there? So we can able to get more understanding who is watching in Facebook. We have a lot of people go into Facebook, by the way, nowadays, because people say, oh, I don't know how to go into Zoom. But that's okay. I think we'll just accommodate everybody. But it's really nice to give us a like there. Okay, so really one of the high risks of type 2 diabetic and also pre-diabetic also is that they have fatty liver disease. And the reason is the first thing is obesity. Now, when I am an ER nurse in Hawaii, the obesity, when I see a patient comes in, and many of these patients are very typical Hawaiian or whoever, and they have a big tummy. That could be Asian, could be any, any people. But the problem, the first sign you already see, this guy might be a typical diabetes because they have a big tummy, they look overweight, obese, and with that, when you take when they're sick, all the description, they know, they are either a pre-diabetic or already diabetic. And many people of this, when they get sick, they start realizing at that time they are diabetes, okay? So it's something that is so common. I saw so many of these people in the ER, emergency, and I said, wow, that's a good indication. I don't have to ask any question. I can already kind of know, well, I better check on the blood sugar, make sure that the liver enzyme, all those things already being suggested in my mind. Okay, 各位朋友，因為我嗰陣時係一個急症室護士啊，咁喺美國嘅時候咧，就見到啲人咧入到嚟咧係大肚墩嘅，哇！呢個大肚墩，咁佢當有大肚墩嘅時候咧，有好特別咧，當佢有大肚墩嘅，就我哋仔已經預計佢呢個係第一個好嘅現象咧。佢可能有個叫脂肪肝啊，咁如果係脂肪肝嘅時候咧，佢多數係會有糖尿啦。咁如果糖尿好多時咧，呢啲人咧都唔知自己有糖尿病嘅，因為佢而家病。咁我首先已經知道話底要睇佢血糖 OK 啦，高唔高啦，佢個 liver enzyme 高唔高，所以其實咧已經好快咗咧，你知呢個人係有咩事。所以變咗嚟講咧，你係知道咧脂肪肝係容易睇到嘅，同埋好 common 咧喺個即係糖尿前期或者係糖尿患病者裏邊兩個都有嘅。So other risk factor risking liver disease are high cholesterol, high blood pressure, and 30% of the U.S. people are having actual liver disease lead to liver failure. So you don't want to get yourself liver failure because liver is extremely important organ for you. Now, one of the things that jokingly saying it, well, in fact, this is a doctor was telling me, oh, I love this patient. So I was wondering why you love this patient. He said, because this patient see me all the time, every month. I have to give him medication. I have to take care of him until he dies. So because his health is so poor. That's why he said, I love this patient. Now, certainly, this is more jokingly way of seeing it, but that is a fact because you don't want to see a doctor all the time, depend on meds. And when you have fat liver, you have diabetes, you better really need to control yourself. It's choice. Do you really want to see a doctor every month, get medication, and every time you get very sick and then not healthy, enjoy not a quality life? Really, you have to think about that. And for me, I start seeing myself actually almost into that boat. If I didn't found Lowsutea, I would probably the same thing, my belly coming up, because when I started developing Lowsutea, I was 225 pounds. And now I'm 195 pounds. By the way, I just meet my target and my tummies are gone. Isn't that great? And really, at the end of the day, when I see a doctor, they say, hey, your A1C was 6.9, now dropped to 6. So you're good. You now get back to the pre-diabetic stage. Now, I really took my effort to do all the good stuff. So you got to keep in mind, you can do it, and you can do it. Just a matter of you can determine. So, 嗱，各位朋友，其實咧有一樣嘢咧，多數有即係呢個脂肪肝都係肥胖嘅，有大肚燈，因為近時我喺急症室做嘅時候，成日叫呢啲人。第二樣嘢咧就係佢個 cholesterol 高，即係話咧佢個膽固醇高。哇！如果膽固醇高咧，就有好多呢咁嘅人咧係有呢個問題嘅 cholesterol 高。第三 blood pressure， 嗱好多呢啲咁嘅人好特別喎，入到嚟嘅時候咧，佢好病得好辛苦。咁其實咧佢就，但係好多人都唔知道佢自己係前期患者糖病啦，亦都唔知道佢自己有糖尿病啦，即係轉咗都唔知嘅。咁其實咧我哋 pick up 咗好多呢咁嘅人嘅。咁其實有個醫生就同我講笑啦，佢話好中意呢啲咁嘅病人啊。咁我話點解啊？佢話呢個人啊成日啊每個月都要見我一次嘅，因為佢病得好舒服好辛苦。第二我要俾好多藥佢食嘅，咁變咗嚟講咧藥成日見，咁佢當然啦呢個病人就即係 stick to him 啦。咁其實佢講笑啫嚟，佢話哇 I love this patient because 佢成日嚟見我，成日揾我，咁成日要俾藥食。咁但係首先你問翻自己，你想唔想做呢種嘅病人？成日要食藥，成日見醫生，成日冇乜好嘅即係健康生活，咁唔係好正仔係咪？嗱，足健你都講啦，咁但係我覺得都係嘅喎，因為如果係咁嘅話，我唔應該係成日見醫生啦，希望我都唔想見到醫生，真係得意咩？所以其實咧，如果你管好身仔，咁你冇個肥肝脂肝，亦都唔會糖尿病有問題嘅話，咁你好多病咧都唔見咗嘅。所以記住要真係控制。嗱喺美國嚟講咧，其實喺個肝病裏邊咧，30%人口已經係糖尿即係呢個肝病嘅人嚟嘅。咁好多人咧係變咗咧由肝變咗係佢有個 liver damage 啊。咁就成個肝死咗嘅，哇！咁就好弊啊！呢個死咗之後就嚴重嘅病，所以唔正仔嘅。所以希望你各位朋友繼續管理自己嘅身體，變得更加好啊。So the sad part is liver disease usually have no symptom, because that's why when the people who come to see me when I was an emergency nurse, those people came up, they are very sick, but they don't know they were liver disease. They have no idea, but they show one sign and symptom is very common sign. They all have this big tummy, sticking out the big tummy. So if they have big tummy, most likely they will really already in that category. Continue fatty liver, and which gonna increase the risk of the liver inflammation, and that will scar the tissue of the liver. And that result, they have to have cirrhosis of the liver, and then the liver enzyme goes up. And then if you don't take care of that, cirrhosis liver will convert it to increased risk of liver cancer. 30% of those people will become liver cancer. And liver cancer, if you have that, the mortality rate is high. And then that result, you also most likely heart disease and kidney disease. And also, if you have pre-diabetic liver disease, also play a role. If you're pre-diabetic, now I'm talking about, it really give you a chance to convert to like much higher because you have the fat, okay? And if you have poor damage diabetes can also form a really fatty liver disease and become worsen, and then end up you have liver failure. So liver disease are very important and is a major cause of type 2 diabetic death, okay? So this is all come together that you really take care of your liver, correct? Okay, so let me share with you a story. The reason why I still remember, one guy came in Hawaii. He has a gigantic tummy. Eventually, he has a heart issue. He has to do bypass and all kind of stuff that come with. But I actually went to take a look of the surgery because I'm in ICU also. And in all the bypass surgery, a patient also come up to my ward. So I actually went and take a look. Then I look at that. His heart, all the aorta, full of fat stuck to it. And then his liver full of fat. And pancreas full of fat. His abdominal, the peritoneum are full of fat. Wow, I was saying, geez, this guy is totally fat in all over the body. So you can imagine if you lower your liver fat, most likely you also lower other fat. That's why his heart disease are prominent, are more liver disease are all related together. They got all stuck together. So keep that in mind. You want to eliminate that risk, okay? 嗱，各位同友，因為咧喺嗰個脂肪肥嘅脂肪肝嗰度咧。係喺我哋嘅糖友同埋前期患病者嘅糖友咧係好常見嘅。嗱，因為如果你有一個大肚墩，呢個已經係一個 sign and symptom， 你 most likely 有個脂肪肝嘅問題㗎啦。因為佢個大肚墩一定係裏面好多肥嘅，唔係個肚墩你有唔大咧，唔會有咁多肥喺度嘅。咁如果你有咁多肥嘅時候咧，你就係增加咗你個肝會係發炎，即係會發炎咧，同埋硬化。咁如果硬化咗之後咧，有個問題咧，你個硬化咗咧，就你個 liver enzyme 咧就會 go up 噶啦。OK， 如果你 liver enzyme 咧，你肝會 go up 咧 ，liver enzyme go up 咧，咁有時咧，你好多時咧啲咁硬化咧會變咗有咩啊 ？liver cancer， 即係肝癌啊。咁如果肝癌咧就好難好嘅，即係個死亡率係高嘅。第二，你 most 嚟都有心臟病嘅問題，因為你好多肥啊嘛。話俾你聽。第三 ，kidney 嘅問題亦都會影響。所以如果你係 pre-diabetic， 如果你係前期患病者，如果你有個呢個叫做脂肪肝咧 ，most 嚟亦都 drive 你去咗邊度啊 ？diabetes 嘅糖尿患病者。同埋如果你唔管理呢個脂肪肝管得好咧，弊家伙啦，你個肝繼續硬化，繼續敗咧。可能你肝就會死啊，或者係會 liver failure， 咁你就好病重嘅。聽完呢個係一個唔係簡單嘅東西。咁同埋仲有一樣咧，呢個喺 diabetic type 2裏邊咧，死亡高咧係因為脂肪個 liver disease 嘅問題咧，即係個肝嘅問題咧，令到你死亡咧係高嘅。咁我講一個古仔俾你聽啦，就係我近時喺 emergency 做嘅時候咧，好多人入嚟咧，有啲人入嚟個大肚墩。咁我第一諗到呢個人都係有脂肪肝問題，佢哋都真係唔知道自己係糖尿病嘅，好多時都係冇人知，因為冇先頭啊嘛。因為脂肪肝係冇先頭乜滯嘅。咁佢嗰時咧就去到心臟嘅問題啦。咁我去睇下佢即係開刀佢整個心嘅時候咧，哇！佢見到個肝全部係好肥，個大血管 aorta 又係好肥，好多肥咧，全部喺個肚嗰度好肥。所以肝全部嘅東西，如果有個脂肪肝 most 係好多地方都有好多肥膏喺度啊。所以如果你降低個肝嘅肥咧 most 你降低其他嘅肥，咁啊見到你更加健康啲嘅。OK， so really you want to be yourself to really cut down your fat in the liver. That would be the best. Now, since there are no symptom, most likely the way to identify your fatty liver is by blood test, which the doctor will go do it. So most likely they will check the ALT blood test, and the normal is 7 to 56 units per liter, And for men, usually stay around 10 to 40. Women is 10 to 35. And AST will be another measurement that you use, which is 10 to 40 units per liter, and which is all these check the liver enzyme. Now, liver enzyme review basically 98% your liver disease, and most common fatty liver disease are being identified this way. And also chronic hepatitis, like Hong Kong people, a lot of hepatitis B, also identified like that. If you have fatty liver and you don't drink alcohol, also ALT will go up for sure. Like people who doesn't drink alcohol, they drink less than 20 grams alcohol a day. If they have increased ALT, that means they have fatty liver disease and very common on typical diabetes, especially they have this big tummy. Now, if you over 70 unit if you're over 70 unit of per liter ALT, if you do things properly, you can actually reverse back to normal in 6 months. And that's what I try to pass this message. Is not, wow, I already have fatty liver, I won't get well. That's not true. You can get well if you do the things that we will talk about later, because that will help you tremendously. It's the same thing you have protect yourself on diabetes work here. So do that. 嗱，記住，如果你係脂肪肝咧，只係一種嘢咧，係能夠你知道咧係點 identify 咧，係 based on 你個 liver enzyme，the elevated liver enzyme. If your elevated liver enzyme 咧，如果你個 ALT 係高 up 嘅話咧，咁你個ALT 高 up 咧。係如果你普通人，你應該7至56個 unit per liter 嘅啫。咩人男士咧就10至40啦，女士就7至35啦，同埋仲有 AST 咧就係10至40 unit。多數啲醫生就用 ALT 先嘅。咁如果你 check 個 liver enzyme 98% 都 identify 到你係咪 liver disease 㗎。同埋喺呢個糖尿患病者係好多有呢咁嘅人咧。有呢個 liver disease type 2咧係 ALT identify 出嚟嘅。咁如果你係有 AST 高 up 咧，其實有一樣嘢咧就可能你有 hepatitis 啦、cirrhosis liver 啦、其他嘅 liver disease 咧或者 heart problem 都有pancreatitis 咧，你個即係胰臟發炎咧都有 AST identify 嘅，唔係 ALT。所以變咗嚟講咧，呢個兩個 test 咧 ，ALT 同 AST 係一個好重要嘅東西 ，identify your liver disease. So keep that in mind. ALT is a way of identify your liver disease. Now, if you are really over 70%, or rather 70 unit of per liter ALT, if you do the things we'll talk about later, you can actually prevent your liver damage and you can reverse. And I saw it from my own eye. Actually, people will go back to 40, around 40, rather than they have 70. So they can drop that if they do. It took 6 months to do that. Around 6 months, they will do that, okay? And also, AST will be also indicated you have hepatitis, cirrhosis liver, other liver disease problem, and also high problem, pancreatitis, also using AST to identify that. Now, so the things that we talked about earlier is how are you gonna now identify of your liver disease? ALT is the lab blood test to test, right? So the question is, well, how do I decrease my fatty liver? Okay, so it's a typical things that we do to help ourselves in diabetes. It works in also decrease liver, fatty liver. So first, we'll talk about how to take a healthy diet. The healthy diet, you have to really get healthy diet. And we'll talk more about healthy diet because there's a lot to talk about. So we'll talk about a little more in the next slide. But you have to really aggressively do your exercise and you have to increase your activities. Because activity burn out your sugar, decrease your fat, and also decrease your blood sugar. And on top of that, you got to drink Lowsutea to help you lower the blood sugar. With doing all that, you also, because you exercise all that, will also decrease your blood pressure. And on top of that, you're going to have lower LDL and triglyceride. With the diet control, you will also lower those things. So lower cholesterol also will help you decrease your fatty liver. And also, you cannot drink alcohol anymore. If you drink, you can drink very little, but not to drink a lot because alcohol would not help you on your fatty liver. Plus, it highly suggests you lose 10% of body weight because you can maintain better weight. That means you lost quite a bit of fat. Actually, if you can lower even 20%, the better you are, the lower you are, you get rid of this big tummy. That's the most important. A lot of people don't realize that. Giving a big tummy, lost 10%, you know what? You also decrease 1 point the A1C. Isn't that great? So the body weight has a lot to do with lower your fatty liver. 嗱，頭先講喺度啊，我哋講咗頭先咧要一定驗血 ALT 啦，去度啦。咁你要如果你係高嘅話，即係嗰70個 unit per liter 嘅話，咁好重要咧，就喺個 diet 方面咧。嗱，呢個係同你糖尿病一樣做法嘅，應該我解釋多啲俾你聽。咁 diet 咧控制咧係頭先再話多次咧，係會幫助你更加了解，同埋咧就要你係做好多 exercise。咁啊糖尿病你都要做 exercise 啦，咁啊幾好 aggressive exercise。Increase activity， 因為當你咁做 activity go up 啊 exercise 啊，會降低血糖，同埋再飲去糖茶，亦都降低血糖。同埋呢樣嘢咧，你 exercise 咧會做咩啊？降低血壓啦，同埋亦都你有 dieting 啊嗰啲咧就降低你 LDL 嘅壞嘅 cholesterol 啦，同埋你嘅 triglyceride 啦。但係有一樣嘢唔可以做咧，就係唔可以飲酒。嗱，唔可以飲酒，仲有咧就你係 loss 即係降低你磅數。磅數幾多啊？最緊係10%。如果你係200磅嘅，你減咗20磅嘅，哇，咁已經減低1個 point 嘅 A1C。On top of that， 亦都一定係減得你肥㗎啦。咁如果你減得20%，哇，更加正。如果你係200磅，2%即係180磅咧，會更加正，會更加令到你咧6個月後咧真係會能夠變翻一個好嘅人 ，rather than 你個fatty liver 降高繼續高。So we talk about you have to identify ALT, know you have I have fatty liver over 70 unit per liter. So now what I'm doing next to better dieting, exercise. So what diet do I take? Lots of vegetable and low sugar foods. Okay, you have to eat a lot of vegetable. In other words, a lot of no starch vegetable. So a lot of lettuce, a lot of all the good greens live. You can take a lot of things like tofu and also greens like spinach, broccoli. So you can actually prevent the fat build up in your liver. So a lot of vegetable. And you have to have high fiber food plant like whole grain. And you don't want to eat a lot of sugar. You have to decrease the salt. You have to decrease trans fat, meaning cut off the McDonald's. Really, at the end of McDonald's, have a lot of trans fat stuff. Refined carbs and saturated fat. Those are things that you have to cut down. So, and you have to have low fat, low calorie diet. So some of the example would be like tofu, which is build up more protein but reduce build up of fat. Okay, a lot of protein but reduce the point of fat. You gotta eat a lot of salmon. Tuna is high omega, which help you to decrease inflammation of the liver. Avocado also help you to decrease liver damage. So all those are good. As I mentioned earlier, spinach, broccoli, it will be very good to build up less build up fat in the liver, and it will help you to become a healthy diet. So this is similar to the thing that you do in prevent control of diabetes. So very, very good. So 各位同學嗱，頭先講咗咧，我哋話你 diet 要食，即係喺個食物方面要有控制啦，要做 exercise 啊。咁食物方面有咩控制啊？飲食方面，第一真係要食好多菜蔬，同埋咧要揾啲菜蔬咧係綠色葉嘅菜蔬啦，就唔好食咁樣糖嘅生果啦。同埋咧要食 high fiber 嘅東西啦，即係好多纖維高纖維東西啦，同埋咧要好多有有高纖維植物嘅食嘅有穀物嘅東西啦， 同埋食少糖啦、少鹽啦，同埋咧有啲反式脂肪或者碳水化合物嘅東西減少啦，同埋咧就即係學你話齋，唔可以去食咁多麥當勞嘅嘢啦，同埋咧仲要咧就係要食啲低肥同埋低卡路里嘅東西。咁有咩好啊？豆腐啦 ，for example 好啦，三文魚啦 ，tuna fish 啦，tuna 魚啦，嗰啲全部有高嘅omega 3啊。因為 omega 3咧係幫助你降低個 liver 嘅 inflammation， 降低腫個 liver 唔會腫啊。咁同埋 avocado 亦都可能夠咧牛油果咧幫助你降低個liver 嘅 damage。咁所以變咗嚟講咧，你呢啲嘢全部係幫助你係降低你個肥嘅 build up 喺你個 liver 度嘅。所以 this is very good. So dieting is going to be one important strategy. Now, if you do this for 6 months, your ALT will go down, definitely will go down, but you have to exercise also. So let's talk about what other food to avoid the fatty liver. So unfortunately, really, you have fatty liver, you can't really drink alcohol anymore. So you have to stay away sugar food, candy, soda, fruit, juice, high sugar thing to build your liver fat. You have to cut that off so you no longer build sugar that increase the build up liver fat. Because when you increase sugar, guess what? The liver fat will build, right, in the liver. You have to limit your fried food. So in other words, you cannot really go to McDonald's all the time, eat hamburger and also the French fry. That is not good. It will help you to increase the fat plus calories. And you have to lower down the salt. The salt should be about 1.5 milligrams per day, because the salt actually have increased the water retention in the body, that which is going to help you to increase your blood pressure, plus your angle, everything will swell up. So that is so important. And then you really cannot eat any kind of white powder, white rye, pasta. If you want to eat, very little. So remember, plate manage is all these things is going to be less than 1/4 of the plate to eat all those stuff. You want to eat it, but anything with high processed food is no good. So because that will always increase the high blood sugar, and red meat like beef, deli meat, which is high in saturated fat, you also have to cut that. So net result, you really become a more healthy eater. And it's the same thing you do in diabetes. It's no different. You do it in this fatty liver treatment. Okay, it's the same thing. Even with that, you actually become an even better and healthier person. Okay, so 各位朋友嗱，記住有咩食物係應該唔應該食咧？如果你有脂肝荒嘅話，第一唔可以飲酒啦，第二真係要唔好食咁多糖嘅食物，好似糖啊、soda 啊，即係飲汽水啊、fruit juice 啊，同埋所有嘅 high sugar 東西咧都要離開。個原因咧，因為你俾咁多 sugar 咧，個 liver 個 fat 咧，個肥咧，脂肪方咧就會繼續高 up 嘅，繼續上升嘅，所以唔正仔。同埋所有煎炸嘢咧就唔正啦，因為煎炸係 high fat 嘅，同埋卡路里又高啦。咁同埋咧仲要食鹽咧，食夠1.5個 milligram per day。嗱，點解咧？當鹽你食得多一滯嘅時候咧，你個水分留喺個 body 裏邊啊，身體裏邊啊，咁你 increase 咩啊 ？blood pressure。第二腳會腫，所以好多人飲咗去糖茶，你話好正喎，我隻腳唔腫喎。個原因就係將嗰啲鹽啊排咗出嚟啊嘛。咁所以其實咧真係唔好食咁多鹽，同埋任何嘅白粉都唔好食啦，因為白粉俾咗啲咩啊糖啦、飯啊、pasta 啊全部唔正啦，同埋 white bread 啊都唔正啦，白麵包，同埋咧紅肉，同埋嗰啲所謂叫做 deli 嘅 meat 啦，好似嗰啲 pepperoni 啊。嗰啲咧全部係好 high saturated fat， 好多高脂肪嘅東西，高能脂肪咧係擺喺度嘅，所以呢個you have to eliminate。咁變咗嚟講，你唔好加多啲咁嘅脂肪喺呢度，咁你食咗佢咧就加落去肥肝啦，變咗 OK 嗱。So in summary, here is so I'll give you an idea. You can actually take a picture, easy to do, because one, if you really do unhealthy lifestyle, for example, you eat a lot of red meat, hamburger meat, a lot of white powder food, flour, soda, candy, butter, all these stuff is actually will get you the fatty liver creation. Now, when you have fatty liver creation, first of all, what happened is your blood vessels will really become fatty. So plus that, you're going to start forming obesity at the big tummy. So this is vascular obesity. And with that, you will start blocking all the things on your body, and you will start forming also liver fats, and your muscle also liver, because your liver fat, your insulin become resistant. You'll be actually end up turning yourself to a diabetes, plus your gut, all the microorganisms, because you have millions of microorganisms to help you digest, will also damage. So net result, your digestive system all screwed up. So this is sort of give you a picture. I got this because I thought that, telling all that is hard to remember. So maybe I give you a picture so you can remember. Because if your liver start inflamed, become all of fat, it starts scarring the liver and it becomes cirrhosis of the liver. And we have cirrhosis of the liver, we have all the different consequences come along. 30% of people with cirrhosis of the liver will end up with cancer disease. Wow, cancer. And that's high mortality rate. So that's not good. So basically with this, you have an easy to understand why you really take effort to lower your blood sugar, lower your sugar, your liver fat, to help you to understand this is something you don't want to be in that boat, okay? 嗱，各位朋友，我講咁多嘢之後咧，其實有個重要點咧，就係第一，好容易咧記得翻咧。第一，你唔想食嗰啲紅肉啦，唔好去咁多麥當勞食嗰啲 hamburger 嘅東西啦，亦都唔好揾啲白粉去食嘢啦，即係白麵包啊、意大利粉啊嘅東西啦，唔可以飲咁多汽水啦、甜啦、糖啦、牛油啦。咁呢啲嘢咧，全部咧係令到你會脂肪肝嘅 ，OK？ 咁當然啦，脂肪肝咧好多時候就大肚腩。你個大肚腩咧，第一樣咧就係個叫 visc， 呢個大肚腩 visc 係一個喺嗰個大肚好多keep 好多肥咧，就多數你係會重磅咧，有 obesity 嘅問題啦。咁同埋仲有你啲 muscle 咧，亦都會令到佢咧係抗拒咗胰島素啦，咁佢有個 insulin resistance 啦，咁亦都會變咗你係糖尿病更加深嘅糖尿，或者你前期患病變咗糖尿病啦。你個吉亦都有好大問題咧，個吉係裏面有好多嘅微生物咧，係當你 digest 嘅，當你有呢啲咁嘅脂肪肝係減低咗呢個 function 嘅，同埋最大問題咧，當你個脂肪肝有好多脂肪肝嘅時候咧，亦都加咗，即係令到你個肝咧係會開始硬化。咁裏邊硬化咧有個好大問題咧，第一個就係多數有30%脂肪肝嘅 cirrhosis of liver 嗰啲人咧，係會有呢個肝癌啊。咁肝癌係死係好高嘅。咁所以變咗嚟講，呢個全部你都唔想喺呢個 position。所以其實咧，我哋食嘅嘢真係有好大影響我哋成個肝。所以今日嘅 lecture 咧，最重要就係知道點能夠防禦到你個脂肪肝。但係你防禦咗之後咧，你係可以改變嘅喎。記住，如果你曾經學我哋頭先嘅嘢喺 diet 度做嘢啦，同埋咧係可以能夠食個好嘅 diet 啦，同埋 decrease 你個磅數啦，同埋咧亦都係做好多 exercise 啦，同埋 control 你個 blood sugar 咧。咁呢啲嘢咧係全部係俾你能夠令到你咧係可以降低你個血糖，同埋改變你個 diabetes， 仲有飲埋去糖茶咧，令到你個糖更加降低咧。你可能第一有兩樣嘢啦，就可以做到咧個血糖係可以降低到咧係能夠好似普通人一樣。第二樣嘢亦都可以令到你咧係可以個脂肪肝喺6個月內，你嘅 ALT 如果你係70高啲咧，去翻50或者40，咁係好正咯喎。OK， so really at the end of the day, if you want to reverse yourself, fatty liver from ALT from 70 or higher back to 40, 50, then you got to have good dieting control, which I just mentioned, all the good stuff that we have. No white powders, no soda, no sugar, no red meat. Then you can decrease your weight 10% only. But if you can decrease 20%, even better. It will help you on diabetes. It will control your blood sugar. And your diabetic actually will be reversed back to maybe 6.4 or lower. And on top of that, you also will see your diabetes could be, and I saw a lot of my clients already, they were 10 because all the things that we taught them to do, they now got them back to like 5.7, or some of them you go as low as 5.2. I was so shocked they can do that. Suddenly, they also want more help. They drank Lowsutea. So with that, all that will work. So it really, at the end of the day, you're going to ask yourself, do you want to really always depend on your doctors for long-term with drugs, with poor quality of health? Instead, doing a healthy, elderly, healthy expectancy. That is something that you need to decide and choose. Because I talked to a lot of customers, my client, my present client, and then they really didn't think about that part. And when I start suggesting that, hey, you know, if you can lower your blood sugar, you'll be healthier, and they right away see after drinking Lowsutea 6 months, the health become improved with the blood sugar at to 5.7 or 6. They feel much better. And suddenly the liver also improved. So net result, they are not depending on really long-term drugs. Doctor don't have, well, they still see the doctor. They still see the doctor continue to maintain the health, but they don't have all the drug. They feel happier because they exercise, they feel good. So this is something you need to decide. And I think if you have think about it, it's better to healthy than just take some pill and hopefully the best. And the quality of life is poor. So nowadays people talk about healthy elderly and healthy expectancy, not just expectancy itself. All has to be the healthy, okay? So 各位堂友，今日我講到呢度咧，好重要咧，提一樣嘢。好多人我問咗好多堂友咧，我話你係咪想成日都 depend 你個 doctor 俾藥你食啊，同埋你身體健康唔係咁好啊，成世都係咁喎，會唔會好啲咧？或者係能夠令到你嘅糖跌翻去6.4，一路落到5.7，咁你身體更加健康，你繼續運動，你嘅磅數少咗，你唔會有脂肪肝，咁變咗嚟講咧，你本身嚟講咧，你就會有一個追求嘅健康生活，就 healthy expectancy， 即係話我有好長命，但我係好 healthy 嘅，唔係成日去病嘅，咁咪咁好啲咧？咁其實呢個係你自己要諗係咪呢個係你嘅選擇去做呢樣嘢咧？我覺得希望係啦，因為呢個係幫助你第一唔會咁多病啦，錢唔使少咗啦，亦都你能夠 enjoy 享受一個好嘅健康生活，哇，係咪好啲咧？咁今日咧，我希望咧大家係了解呢樣嘢嘅時候咧，咁希望大家去做一啲更加深入啲嘅諗法，咁可能夠飲血糖茶啦、good diet 啦，降低你血糖啦，咁呢個係一個更加好嘅東西。So we will talk about that, and we will able now talk about something more fun now, making a delicious almond bread, which is 2-gram carb, and making a sandwich. But making almond bread, this is the recipe. So can you guys take a picture first? And maybe I know a lot of people may have forgot how to make it already. 嗱，今日我做一個麵包咧，係個杏仁麵包加吞拿魚嘅，好好食嘅。咁你首先咧就整杏仁麵包點做嘅時候，你影張相先。咁然後之後咧就我哋再去講其他點去做呢個杏仁麵包嘅東西係好正。嗱，呢個杏仁標咧，我係好中意食嘅，本身都我亦都唔係淨係堂友食啊。其實我太太唔係堂友嚟嘅，佢都食得好開心。我女婿唔係堂友亦都食開心，係都食嘅。So a lot of people don't have to be diabetic to eat almond bread because everybody loves it. Don't have to buy diabetes. My son-in-law, who's a Swedish guy, he loves it. My daughter's no diabetes loves it. My wife, no diabetes, loves it. And all my friends I introduce them like that, they all love that. So this is something, a very good bread, very delicious. And then this is, I will just show you how to do that. So take a picture. And so I presume you guys took a picture already. So I'm going to now go to the next slide, how to make this almond bread with tuna fish. Okay. So let's look at this.
Hi, I'm Angela Lowsutea President. Hey, you know, we have now taught so many things now. We have talked about breakfast with pancakes, waffles, different type of breakfast item, 9-second bread. And a lot of people say, wow, you know, this is really good. You know, I got all these different breakfasts and I need something for lunch or snack. I said, no problem. We have already taught you how to do the almond bread. Remember, the almond bread looks like this. The one that looks something like that, and they were made is 2-gram carbs. Remember that? And it was very delicious. So I'm going to stop the camera first. I will teach you how to do almond bread first, and then I'll come back. Hi， 各位朋友，我係 Angela Lowsutea President。記唔記得咧？我哋好多上幾次嘅片集咧，就講下點整 pancake 啊、waffle 啊，咁個個都話哇好中意喎，好好食又正又好，又 low carb。咁仲有咧，啲人就話喂 ，Angela 可唔可以教下煮咧其他嘢咧？好似或者晏晝有冇三文治好正㗎？或者仲有冇一啲嘢好似 snack 又可以做到㗎？冇問題。我哋依家記唔記得上一次做過嘅 almond bread？ 呢個就 almond bread 好似咁啦。咁我就首先咧停一停個相機，然後咧影翻個 almond bread 睇先，然後做咗 almond bread 出嚟，然後教你哋其他嘢用 tuna 魚嚟做。Okay, see you later. Hi, I'm Angela Lowsutea President. Today we're doing something really fun because what I'm going to teach you today is to make almond bread. Almond bread is only 1 gram carb, and you can make it for sandwiches, you can make it for breakfast, putting peanut butter. It's extremely delicious, it's low carb, and also versus you're better to eat the 13 grams of white carb bread. So this is extremely a good choice for your breakfast for diabetes or pre-diabetic person. 今日好開心，我係 Angela Lowsutea President 教你咧係點做呢個杏仁麵包。杏仁麵包咧只係1 gram 嘅 carbs， 好過你食個白麵包咧係13 gram 嘅 carb。咁所以變咗咧，其實你可以做搽花生醬啦，或者晏晝咧可以食三文治啦，加啲 tuna 魚落去咧係好 delicious。對你十分好，係幫助你糖尿病嘅朋友，或者糖友，或者係前期患病者嘅，可以降低血糖，因為只係 1 carb。咁首先咧，我哋如果係做呢個杏仁麵包咧，一定要講要用咩材料嗰度先得啦。咁我會繼續講嘅材料嘅。In order for us to make the bread, we have to tell you what ingredient we have in there. So the ingredient, first of all, we'll go through all the ingredients. Then we'll go after that, we'll show one by one, and then we'll mix it in this metal bowl. So first of all, we have 140 grams of almond flour. 第一個材料係有140克嘅 almond 麵粉。第二樣嘢有50克嘅 psyllium husk. The second item is 50 grams of psyllium husk. 第三個材料咧就係我用4包嘅sweetener， 咁我依家係用 splendid sweetener， 咁亦都可以用其他嘅 sweetener， 可以 equal 啦，或者可以用 stevia。雖然 stevia 咧係1個 tablespoon 嘅，咁當然啦，呢個就我哋現在係用 splendid 啦，易啲做啦。咁仲有咧係1個 teaspoon 嘅idle salt， 即係 table salt 啦。然後2個 teaspoon 嘅 baking powder. So you're going to have besides 4 sachet of Splendid, we have 1 teaspoon of regular table salt and 2 teaspoons of baking powder. And then 2個 teaspoon 嘅 apple cider vinegar， 即係話if you're gonna have 2 teaspoon apple cider vinegar and then 40 grams of unsalted butter。 So 如果你係 supermarket 買一排嘅，就係呢啲咁嘅冇鹽嘅牛油，咁用咗佢咧就變咗咁。Okay, so 40 grams unsalted butter, and then 3 egg whites and 1 egg yolk. You can see that right here. 3個雞蛋嘅蛋白同埋1個egg yolk。OK， 咁仲有咧，最後啦就1個 cup 嘅 hot water 熱水啊，1杯嘅熱滾水。OK， 1 cup of hot water。OK， now so the next step what we do is we're going to do that. Okay, now you know the ingredients. So next step we'll do is going to start mixing all the ingredients into this metal bowl. So first of all, we need to put all the dry items together. 嗱，現在咧你已經知道所有材料係啲咩啦。咁首先我哋 mix 咗啲乾材料先。咁首先咧我就將140 gram 嘅黑嘅 almond flour放去。So first ingredient we're going to have 140 grams of almond flour. Put it inside the bowl. So put it all inside here. Okay. So secondly, I'm going to put the 50 grams of psyllium husk。 第二樣嘢咧就放50克嘅 psyllium husk。咁我放去啦。咁我都 mix 晒佢先，因為如果唔係咧好難 mix 喎。遲啲 mix 下佢，咁 mix 晒啦，繼續 mix。咁啊 mix it 勻勻啦 ，mix 晒佢。So you gotta mix it, really mix it well. Okay, and you have some lump, mix it, and all together mix it. And the third one, we will also put down the blended sugar, or you want to use a blended sweetener, or if not, you can also use other sweetener like equals, or if you don't like it, stevia will be okay. So now we'll do it, mix it and mix it together. So now we'll also mix together. After mixing together, you're gonna mix it well. And next we're going to do is we're gonna bring in 1 teaspoon of salt. So now we'll put the salt together. So all the salt here, 1 teaspoon of salt. Keep mixing. I tell you, this is very easy. 做呢個 mixing 咧係10分容易嘅，係撈埋佢就搞掂㗎啦。咁然後咧就2個 teaspoon 嘅 baking powder. So next step, we use the teaspoon of baking powder. Again, we mix it together. Mix it again. Mix it well. Mix it well. See, I tell you, I'm not a cook, but you can do this very easily. 其實我唔係一個真係好好 cook 啊，但係其實咧。做呢個咧係10分容易做嘅。嗱，其實我個孫都做過嘅，呢個佢都得㗎。So my grandson can even make bread like this, just like this, so easy. Certainly, the mom is helping. Now then we use the 2 teaspoons of apple cider vinegar. So next step, now we'll put the 下一個 step 咧就係2個匙羹嘅apple cider vinegar 啦，又 mix 上去喎。OK， 又 mix 啦。繼續 mix， 繼續 mix。咁開始 mix 下咧，就已經開始有啲嘢見到又乾乾地啦。咁我而家又再 mix 晒佢啦，要 mix 多啲啊，要 mix 多啲好嘅 ，OK。好啦 ，so then we're going to start putting 40 grams of unsalted butter. So next step we're going to have is 40 grams of unsalted butter. So 我哋而家下一批咧就係用嗰個40克嘅呢個牛油啦 ，OK， 又 mix 咗佢喎。而繼續 mix 上，咁樣 mix 下咧，其實你開始有啲冧冧地嘅，咁啊 mix 多啲嘢好嘅，咁啊繼續 mix 啦 ，OK， 啱 mix 多啲更加好 ，OK，go continue mixing. So you're gonna start seeing some mixing, and you already see some lump. So we're gonna continue to mix it all well together, and so just be some patient to mix this together. So this is okay, very easy to do. 嗱，其實樣做嘢都唔係好難嘅啫。全部都係將你 頭先所有嘅東西咧，只係咧 mix 晒佢咧就差唔多揀咗㗎啦。OK， 咁啊 mix 晒嗱，咁我依家咧就開始 mix 我個雞蛋啦。Now we're going to mix our 3 eggs, and then our 3 eggs is white, the 3 egg white, and also 1 egg yolk. So now we're going to start putting this in together and slowly putting together, and now we'll put this together and we'll mix it. Okay, we've got it in and we'll mix it again. So actually it's so easy to do. 其實好容易啦，幾容易做呢樣嘢。咁我就繼續 mix 喎，咁繼續 mix mix 完之後咧，遲啲咧我就會揾啲即係我哋嘅熱水咧，又擺落去啦 ，mix 晒佢啦，咁然後咧就一路繼續 mix， 嗱要 mix 得循環環啦，所有嘅跑嚟 mix 晒佢先得喎。So you have to mix the flour, everything good. You see all these flours not mixed well, so you have to do that together and do it right. Okay, you see all these flour, husk flour, not mixed well, so you got to do some more mixing. So actually 真係好易做嘅呢個其實咧，如果你話坐喺度咧，你淨係就咁撳，即係就咁坐喺度 mix 下佢，咁就可以做到呢個東西出嚟，有幾易咧？做呢個麵包一啲都唔困難 ，OK？ 其實一啲都，其實麵包唔容易做㗎，因為如果你做唔到咧，麵包唔起嘅。但係呢個咧就好容易做嘅，真係好容易做。咁依家就教你做埋點去做啦 ，OK？ 咁嗱，咁最後呢個 step 咧，我哋就擺一半嘅熱滾水落嚟呢度，因為咧依家已經係一嚿嚿㗎喎，咁我哋擺熱滾水咧，再 mix 多啲佢先 ，OK？ 咁我依家擺熱滾水落去啦。我只係擺半杯嘅熱滾水啊。OK， 咁又再 mix 過咯喎。咁啲熱滾水咧，其實 mix 咗去之後咧，佢就啲嘢咧就更加 mix 得好啲嘅。我哋睇到咁多，一嚿嚿 mix 得好啲嘅。咁更加繼續 mix。OK， 繼續 mix。OK， 咁可能夠啦。現在咧，或者係再加啲熱滾水落去啦。So we're going to add some hot water to make this even more gooey. Okay, so now we mix a little bit more before we put some more hot water in there, and we'll go for our next step. Okay, so we teach you how to get the bread to actually, start doing the bread. Okay, so now we'll get some more hot water. 再加啲熱滾水，再 mix 埋佢落去啦。OK， 你話幾易咧？其實就一啲都唔難。So easy to make this bread. Oh, I so enjoy making this bread. This is so fun. Actually, it's so easy to do. So after I finish this mixing, I'll teach you how to put that bread onto a weight scale and then put it on the baking pan. So we're going to show you how to do the rolling of the bread. But after mixing this, just a little bit more, then I will basically show you. I'll down my gloves. I will show you how to do that. But right now, give me a couple more minutes of mixing, then we'll do that. Actually, do you see that? It's how easy. 你覺得好易啊？其實最多做呢樣嘢咧之後 ，mix 搞掂噶咯。OK， 咁嗱，下一步咧，你等我會就依家就嚟咧，就戴我嘅手套嚟做嘅東西。OK， 咁你等我1分鐘嘅啫。OK。Okay, now we mix our dough. So now we have to split the dough to 6 bread. OK， 嗱，各位大家已經 mix 咗刀啦，咁我咧就每一個搓晒佢之後咧，就每一個咧又可以做6個麵包嘅。咁但係你點知麵包每個麵包係咪咁多啱嘅磅數咧，或者係個重量咧？ So how do you know each bread is really about the same? So we have an electronic scale here, which means each bread is about 95 grams. So we put it right here, make that 95 grams. Here, this is 95. So put it here first. And next one, we pull out again, and we'll try to make it to 95 grams. So that is one. Okay, 95 also. So don't worry, it doesn't look right. It's okay. because I just pull it out. Again, look here, 95 grams. Wow, wonderful. So we'll do the same thing, you know, put that 95 grams, put, okay, 95. If you have slightly more, doesn't matter. 全部有98或95嘅克一個麵包都 OK 嘅，但係如果唔係咁多都冇問題，即係多少冇問題嘅。Okay, so you just make it in such a way. It's about 95 grams. So now I did it. Now it's all 95 grams. Now you notice the bread doesn't look that right. That's okay. So what you do is flatten up, you know, make it like that, and you fold it, fold it this way, and that result you make it like a ball, and it looks much better, like this. Does it like a ball? Then you can actually put it on your baking pan. So I put one in the baking pan, and this one looks about right. So we get the second one in the baking pan, and this one doesn't look too right. So I will flatten it up again. I'll do this, fold this way, fold this way, fold this way, fold this way. So make it in such a way that you can look like look a little bit better. Okay, see one more bread again. See how you make 所以咧，如果你啲麵包唔係咁靚仔，唔緊要嘅，其實咧就可以咧就煲整咗之後咧咁上下圓腍就 OK 噶啦 ，OK。咁然後咧再將啲麵包煲落嚟擺喺度，每一個呢個 recipe 咧係做咗6個麵包嘅 ，OK。咁呢個再嚟呢度，每一個麵包係95克或者98克咁上下啦。So each bread is about 95 or 98 bread. Now we make 6 bread ready to bake. 我而家仲有6個麵包已經準備咧擺入焗爐去焗噶啦。Hi, I'm Angela. I'm back again. I brought over my nice oven. This is a convection oven, which is make sure you use a convection oven, not a toaster, because convection ovens have wind that will actually when circulating the air, so you have heat throughout, so you can make the bread real nicely. Or so what you do is you preheat this oven at 175 degrees C or 350 degree Fahrenheit. And you open it, preheat it, and you put your bread into here, and now you bake it for 1 hour. And guess what? 1 hour after that, you have nice almond bread to eat. So you enjoy the bread, and once you make it, I will show you how it looks like. So 你哋依家咧焗175個 centigrade C 嘅almond bread 係焗佢1個鐘頭。咁當然你 preheat 咗個 oven 之後咧，咁你焗1個鐘頭就 OK 㗎啦。咁依家再1個鐘頭再見，我整咗個黑麵包出嚟俾你睇下係點樣嘅。I'll see you in a little while. Hi, after 1 hour baking, now the bread is ready. You can see that will looks really good. 我已經焗咗1個鐘頭啦，咁現在咧我就喺個 oven 嗰度咧係攞出嚟，咁好簡單，攞出嚟嘅時候咧 ，make sure 呢個攞個熱嘅板啦，咁你睇下，呢個就係我哋嘅好嘅 oven bread. And you can take a look, get closer, and take a look of that bread. You see how nice it is? It is actually now easy to make breakfast, lunch, with sandwiches. 你睇下幾靚？呢個就係我琴晚做即係琴日做嘅麵包啦，就1個鐘頭到1個鐘頭啦。咁現在咧已經焗好咗，拎咗出嚟，係咁容易嘅。呢個就係我哋嘅 almond bread 啦。Hi, I'm Angela. I'm back. 嗱，咁 we have made the almond bread already, and you start with the previous video. This is how it looks like, but I'm just gonna cut this in half. 嗱，頭先俾你睇咗咧點做 almond bread，咁我只係斬咗一半啫。咁其實首先咧就揾啲 tuna 魚 mix 咗佢一個煲就係1 can tuna 加 mayonnaise. So very simple. All you do is can of tuna, mayonnaise, and then it's that simple. And what you do is you now put this into here. in this piece of bread here, spread it evenly with the tuna. Okay, and then you go on this side, you do the same thing. And you want to put more tunas, up to you. I think it's about right. And what you do is tuna 魚好簡單，擺 tuna 喺兩方面嘅麵包，然後咧就擺你嘅 lettuce 上去上邊，好簡單嗱，咁就係㗎啦。咁我擺多啲，我係好中意食 lettuce 嘅，所以擺多啲 lettuce。咁然後咧就擺翻個 tuna 魚上去。Wow, look at it. That's how your sandwich looks like. And that's what you do. And you can do is you can cut a little bit like this, and then you can take the sandwich. Let's take a look what it tastes like. Wow, this looks really good. You see how good it is? That's very good. It's very moist. You see how the sandwich will taste like? That's excellent. So anyway, that's how you're gonna make your tuna almond bread sandwich. It's so delicious. It's excellent for your sandwiches, for lunch. It's also excellent for your snack. For any diabetic, under 20 grams carb, it's real good. I love this sandwich because it's easy to make. You can ice it, put it in the refrigerator when you need it, just open it from syrup wrap and eat it. 呢個生意容易做，又煮咗之後咧，整好之後咧，擺雪櫃，當你食嘅時候拎翻出嚟搞掂，或者你擺一個普通嘅即係三元袋咧，又可以拎翻公司食，哇！真係一流。So enjoy. We will teach you more recipe next time. This is Angela signing off. Goodbye.
Okay, good. So I wonder, did you guys have any questions and things like that? So if you do, we could love to answer a question. One of the questions said Lowsutea, does it help? ALT. Now Lowsutea will help you lower the blood sugar. So because lower the blood sugar, ALT will actually improve because it will not contribute to the fatty liver, and it is going to be lower the so-called liver enzyme. So actually indirectly it will help. Okay. So when you do drink Lowsutea, is help the key is lower your blood sugar. Now there are a couple more things you gotta do. You gotta control your diet. You have to really get your diet. And secondly, that's another thing you have to do is control your weight, not your weight, your exercise, because exercise will definitely help you to lower your sugar too. And thirdly, you have to control your weight, because when you control your weight, that means you lessen your fat in your body. And so net result, you will actually improve your overall fat, obesity, and that will help you to lower ALT. In 6 months, you could be improved up to, you have 70 and higher 80, you'll probably go back to 50. But you take 6 months to work, okay? So it does take that long. 有一個問題，佢話 Lowsutea 去糖茶可唔可以幫助 ALT 降低咧？ALT 降低咧，真係會係有個間接性嘅影響佢嘅。第一，因為去糖茶係降低血糖。當你降低血糖嘅時候咧，佢就會幫助你個肝咧唔會有脂肪嘅肥啦。咁因為咁嘅情況下咧，你就仲有一定要做你個 dieting 啊，即係食嘅東西啦。第二咧，你要做好多嘅 exercise 啦，咁亦都降低你磅數啦。咁呢啲整體3樣嘢加埋晒一齊，連埋你低糖嘅喺血裏邊咧，係要幫助你降低嘅 ALT 嘅。咁如果你做咗6個月，真係做晒足呢樣嘢咧 ，most 嚟嘅 ALT 咧就會由70去翻50啊咁嘅。咁所以咧，其實飲去糖茶好嘅重要嘅。I hope everybody understand what really fatty liver will affect your health. Now, one more thing, we have a webinar coming by Professor Simon Au. And mark that on your calendar. For Hawaii time, for US time, will be on the 25th of June at 9 p.m. 25th of June at 9 p.m. For Hong Kong people, will be on 26th of June. It's a Saturday at 3 p.m. This is a webinar you cannot miss. The reason is we talk, and there will be a lot of people signing in. So make sure you get early spot, sign in. The reason why this is a real important webinar to attend is because that is, they talk about what is COVID-19 related and impacting your pre-diabetic client and also diabetic client. And should I take vaccine? And what is the effect of taking vaccine? And what is the benefit of doing all that? If I don't do it, what is the consequences? Because we don't do it, you always have consequences. So all that will be answered that day. Will be highly recommended you take it, because there are a lot of my diabetic client, pre-diabetic client asking me already, wow, you know, I don't know I should take the vaccine or not, or what will affect me? Well, in Hong Kong, there's not too many infections now. Should I take the vaccine? But actually, without realizing, there's a lot of variants, virus might come over and might hit you. And too bad if you get hit, too bad. That's really scary. So you gotta really think about that. 嗱，各位堂友，因為咧我哋6月係26號咧係禮拜六嚟嘅，個香港時間係3點鐘，係講點即係呢個COVID-19 我去唔去做打針去抗疫如果唔打針有咩損壞對我嚟講其實呢個係好重要嘅你如果唔打呢個 vaccine 係咪會令到你個身體會差咧？有可能係，因為依家最大問題咧有變種病毒喺出邊。如果你普通嗰陣時咧唔打，可能或者你嘅好多大半因為傳得好快。咁呢個係如果有呢個問題真係出現嘅時候，即係香港有第5個發炎嘅嘅開始嘅時候咧。咁呢個係如果係啲人唔打針咧，係一個好大影響，尤其是係糖尿病或者前期患病者嘅病。咁所以希望各位都有希望咧，係去過去睇。咁如果大家冇乜問題咧，咁多謝各位。Thank you very much indeed. I really appreciate you take your time on a busy Saturday and listen to our webinar. I hope that it helped you better understand what is fatty liver affecting you. And also, we want you to think about how we can help you to improve health. And have a nice weekend, and we'll see you next week for a different webinar. Take care. Bye. Thank you.